guys, welcome back to yet another session with PLAB 2 NHS. The theme of today's session is teaching stations. Now, teaching stations are challenging and sometimes we might find it difficult to build a rapport with the simulator. And you must have known people scoring 0 or 1 in history taking, which is actually terrible. Today, our very own Dr. Kalpita would be discussing various ways and methods in which you can approach the teaching station and a rough checklist/ideas for the examination. So let's have a look at them.
Actually means to teach, and we have been doing this for years. It's not only us teaching our juniors, but we've been teaching our friends. If you look back upon your medical college days, there's always going to be that one point of time where you've been teaching your friends in the wards and libraries, helping a friend understand concepts, and whether it's through visual imagery, mnemonics, different techniques. We have broken down challenging concepts and we have translated complex medical terminologies to simple language that can be understood. Now, coming to teaching per se, in the teaching stations, again, they will be testing us on these three main domains. That is data gathering, technical and assessment skills, your clinical management skills, and interpersonal skills. Now, these domains are interchangeable and they are intricately linked to one another. So I have now tried to make them into simple demarcations to, better facilitate understanding of the tips that might give you an edge. Now, I'm not saying that this is the exact way to go about it, but this is an approach that has worked in my favor and many of the candidates I have helped. So let's try and see how these points can help us. Now, coming to data gathering, I have often heard of candidates who told me that they have not scored any marks in this section and they have no idea as to what data gathering can be done in a teaching station. So to begin with, now we have a student, a simulator, maybe a medical student or a patient in this station, and you will have to teach them about a concept or a procedure, right? So how do you start off? Of course, we have our greetings and everything, but data gathering specifically, what I feel is important is you trying to understand the student's perception of the subject. Ask what do they already know. Now, for example, if a student comes to you, a medical student, and he says, I want to learn about jaundice. And you start off with the basics. You talk about the pathology behind it, the signs and symptoms, how to go about diagnosing it, and what would you treat or how you would treat. But what if the student already knows all of that? And he only wanted to try and understand the correlation between jaundice and sickle cell disease. But you have gone on to other things. So what has happened now? You have probably lost your students' interest and you probably lost out on time, right? So the best way to start these stations, I would feel, is to try and understand what is it they already know. So you don't end up repeating that. And this will take me forward to my next point, which is specific learning goals. Try and understand what is it that they actually want to learn. Now, suppose we are talking about jaundice, but this student only wanted to understand the correlation. So you save up on time, you know exactly what the student wants, and accordingly, you can teach them. Coming to the next one, set realistic objectives for your station. Now, 8 minutes is never good enough to teach anything. We all know that. I mean, even in our last minute preparations before going into the exam hall, there's nothing new you can probably learn in 8 minutes. So try to explain that to your student. Tell them that, 8 minutes, I probably will not be able to teach you everything. So we probably need to break these into different sessions for you to really understand. But what I can do for you today is, I can probably give you a basic overview of what you want to learn. And how would you feel about that? So in this way, you are involving the student, but you're also setting that realistic objectives for the examiner to understand that there's only so much you can teach in 8 minutes. The next one is structured teaching. As we progress through the stations today, you will try and understand what I mean by structured teaching. There is a certain way to go about. Suppose you are talking about a procedure, you would probably start off by saying, oh, these are the equipments and this is what I will first, prepare and I will keep. Then I'll probably take universal precautions. I will then speak to the patient, gain consent. It has to go in a structured manner. Try not to be haphazard. I do realize in in a situation where we are giving an exam, we are quite jittery and we are quite nervous. And it is very difficult to keep our cool. But try to, hold yourself together and have this structure in mind. Have a skeleton in your mind and, just tick off the checklist. You do not have to by heart an entire script for a station. You just need to have that skeleton that these are the things I definitely need to touch upon. And trust me, that does put you over the edge. Now, coming next to clinical management skills. So, again, as I have already explained, now in the current situation, there are not going to be any patients or simulators whom you'll be touching. Maybe even the mannequin you may not be touching. But suppose you're explaining to the student on the mannequin that this is how we would ideally examine. Do talk about universal precautions. Verbalize. We know it's a given that these are the things you will do. But we tend to forget, again, in this whole nervousness, we might actually forget. So these are the things which I feel you can score upon, which shows that, you are a safe doctor and you're taking all the necessary precautions. Whenever you're teaching to the student that, when we have a patient in front of us and this is how we are going to be doing, you always talk about a chaperone. Make sure you verbalize all of this because this is where you will actually score your points. Next, coming to the basic anatomy or concept or explanation of the procedure, try to give them in like maybe 2-3 lines, a small overview, just for them to understand that this is what we are going to be touching upon. Suppose, for example, we have inguinal scrotal examination. Now, this you're going to be teaching on a mannequin. There's a good chance you may not be allowed to touch the mannequin in the current scenario, or you may. But either ways, you can start off this station like, when you're starting to teach the student, you can probably say that, okay, this is the basic anatomy. Do you have any idea about it? And he may probably say no. So then you can talk about, okay, let's start with the inguinal canal. Now, this is a short passage in the inferior part of the abdominal wall. This is where you most often encounter hernias. And then you can probably start your teaching and go on from there. This now takes me to the next point, that is your clinical correlation or incentives you give to your student. Now, all of us here, we are all sitting in different time zones. I mean, I understand you all have a family commitments, work commitments, and yet you all have joined in for this session today. Why? Why have you all done that? There is an incentive here for you, right? You are doing this so that you probably feel that you will have some learning point that you can take away from this session that will give you an edge or brownie points for the exam. And that is how I now hold your interest in my teaching. So how are you going to hold the students' interest in your teaching? Because that is exactly what we are trying to understand here. So when you have a medical student and you're trying to teach them, talk about some clinical, something that is clinically significant with what you're teaching. Suppose you're talking about urine dipstick station, right? You will talk about how the procedure is done. You already explained the procedure and you'll be like, okay, now we'll look at these charts and these are the things we look at. How do you actually hold that student's interest now? You will say, okay, we are looking at proteins. Beyond 0.5 gram per liter, we term it as proteinuria. And that's just basic teaching. He'll be like, okay, all right, if this is the number, this is proteinuria. But what is the significance of that proteinuria? So maybe you can talk about, how in a pregnant female who had previously had normal BP and now has proteinuria of more than 0.3 grams per liter in her 24 urine sample, along with BP of 140/90 and beyond 20 weeks of gestation. If we see proteinuria in this female, then we have a diagnosis of preeclampsia. Now, preeclampsia is a significant condition. And then, you can talk about how you have to then escalate it to the seniors if they are to see something like that in the wards. So you've given the student an incentive to do something, to show that whatever they are learning from you is clinically significant. Again, when it comes to inguinal scrotal examination, you're teaching them, okay, this is how we examine, this is what we do. You're probably talking about Friend's test. And when you come to Friend's test, you can probably make a statement saying that there is something known as negative Friend's test and something known as positive Friend's test. Now, what is negative Friend's test? You asked him a question. He obviously doesn't know. He says, I don't know. So say, okay, when the testicle is lifted and the affected testicle has no pain relief, that means this is testicular torsion. And again, you have to escalate because this is a surgical emergency. Now, you've taught him something significant, you've taught him something that is so pertinent in an emergency situation. The student has more interest in actually learning from you that, oh, if I actually diagnose this, I would be able to, save someone in an acute setting. And suppose the French test is positive. So this is how you differentiate, right? Negative and positive French test. So if there is a positive French test, that is, there is pain relief when you lift the testicle, then it is epididymitis. So then that goes into a different care pathway. Probably you don't need to escalate it immediately. So you can give the student clinical correlations or incentives to, keep their interest. Now, coming to medical jargon. Now, I understand this might be the easiest way that, you can just throw around all our medical terminologies, but try to understand this is a medical student at the end of the day. They're just making their foray into the medical field. So maybe they may not know all the words. So you can again try to break it into simpler language for them to understand, right? Okay. Coming next to patient safety, comfort, as I said, speak about the chaperone. At the end of the procedure, you can always talk about, giving your patient space or privacy to dress up and, make sure they're comfortable. Suppose you've done a post-speculum examination. There might be at times some little spotting or bleeding. So you can talk about, how we can explain this to the patient that, she may not need to worry if something were to happen. So now, coming to interpersonal skills. Now, this is something that I commonly see is interpersonal skills is not just saying sorry all the time. I do realize the patient is in pain and discomfort, and you are sympathizing. But sympathizing doesn't always mean that you keep saying sorry, and if you do not, then you're not scoring well on an interpersonal skill. This component actually spans your entire station. And I know we are all in that jitters and we are tensed about the examination, but try to relax and be confident when you're building up a rapport. Now, in this particular station, how do you build up a rapport? You ask them, okay, how have your postings been, or how has your study been? How have you been coping with the current COVID scenario? Has that affected your studies? Try to build up that rapport, because the second you have a rapport with your student has an interest in actually learning from you, right? And smile occasionally. This is not one of those stations where something sad is happening. You try to engage your student effectively in that manner by smiling, and ask them again and again. Do not ask them again and again that, are you with me? Do you understand me? I personally feel that can be quite condescending. So how do you actually engage somebody? How do you involve? I know there are different methods. You have your chuck and check and different ways of engaging. What I personally would do is I would try to ask them questions, and this medical student or simulator may not, of course, be able to answer. Sometimes they do answer, sometimes they don't. They simply tell me, I don't know. But after a couple of a couple of lines after I've explained something, or maybe after a few questions, I ask them a question. Do you know how this is done, or do you know about this? And they'll say something. You are keeping the student involved. You're not entirely just blabbering on and not letting them actually have a word in, right? So, and if they say, I don't know, just smile and teach. Tell them, okay, it's all right. Or, and try to be encouraging. Like, there might be a situation where they might say, oh, yes, this is how it goes. And you're like, yes, very good. You know that. So now moving on. So try to encourage your student throughout. I know 8 minutes is lesser time to be actually doing so much. But if you time it right, if you structure your station right, this is definitely doable. Now, coming to everything you've taught, I won't say give them an information overload. Don't bombard them with information. Try to give the important things. And if in the end, if it's possible, try to give them a summary. If you can, or try to understand try to ask them what they have understood from everything you've taught them in that particular session. Then ask for doubts. Definitely ask them, if there's something they did not understand, and if you want, if they want it to be repeated for them. And you can also say that, if you have doubts after the session, maybe you've gone back home and you are reading and you suddenly thought about something, or you realized that I probably missed out on something. Please do come back and let me know, so that, we both can learn. And I feel this is a very important line that should be there, because it shows that you yourself have given, yourself and that student a leeway to actually improve upon your skills, rather than just like teaching and walking away and never looking back upon it. Next, again, feedback. I know, ironically, I take these sessions and I never ask you all for feedback. And some of you all have been kind enough to drop a text and let me know. So thank you for that. But in this station, I think it can be nice if you ask them for feedback. You can probably say if there's, again, if there's something I missed out, or if there is something you would want me to teach you in a better manner, please do let me know so that I can improve myself in further sessions. This again shows that you are somebody who's playing it safe, who wants to improve upon their skills, and you want to make sure the student learns and grows with you, right? So this is what I call the teaching checklist. As I always say, and I think at this point this is probably my catchphrase in these sessions, there is never going to be one glove fits all strategy. We all have our own approaches. This was mine. This is how I feel I would approach any situation where I'm teaching. I may not be able to do it to the word T, but I try.
Thank you for watching. Stay tuned for more videos. See you guys next time.